Welcome to the Inspire Health Podcast. Your life is about to get a whole lot better. Have you ever felt like you tried everything and yet still couldn't find the answers or the solutions that you were seeking? Whether you're dealing with chronic illness, physical or emotional pain, I want you to know that your body is the most sophisticated machine on planet Earth. Your body holds unfathomable wisdom. Trust in it and learn from it. Know that there are answers and there are solutions to your specific health challenges. And we will be uncovering all of them here on the Inspire Health Podcast. I'm so excited to be a part of your healing journey. Your transformation starts now. Hi, everybody. Welcome back to another episode of the Inspire Health Podcast. Today we have with us Steve Donald. Steve is a professional musician for over 35 years. And in 2005, he learned Buteyko breathing for the asthma that he'd suffered with since childhood. In 2006, he trained to teach Buteyko breathing with Jennifer Stark, Chris Bowman, and Steve Lumsdane. And since 2006, he has taught Buteyko to approximately 600 clients in and around the Toronto area. In 2010, he became the founding member of the Buteyko Breathing Educators Association and was elected to the board of directors in 2015 and has served as president and board chair from 2016 to 2019. Steve, it's a pleasure to have you on here. I'm excited to have you as a guest today.
Well, thanks so much, Jason. It's a pleasure to be here, and thanks for inviting me onto your podcast.
Oh, absolutely. I came across Buteyko breathing several years ago, and it was after I heard a podcast from Patrick McEwen, who I'm sure you're quite well aware of. He's a pretty big spokesperson for it, and I'd never heard of it before, and so I looked him up and I grabbed a couple of different books and read through it. It made a lot of sense and started using it in practice. And I've really found like pretty powerful technique to have as your disposal if that most people just wouldn't even know about it. And I sure wish that I knew about it back when I was a kid, because much like you, I grew up with literally like a bubble boy. So, I mean, I was allergic to everything. I had chronic asthma. I was on inhalers. For me, my story went more as I learned about naturopathic medicine and foods and all this stuff, and that really significantly turned my life around. But even today, if I'm ever getting the first signs of getting cold, or if I'm getting congestion, Buteyko breathing is one of the things that I pull out of my toolbox right away, and I find it really quite beneficial. So before we get on it, can you break down for people just what Buteyko breathing is and where its origins were first? And then I'd love to hear your story on how a musician ended up getting so keen on breathing exercises. So
Dr. Buteyko got really interested in breathing while he was in medical school. The sort of the legend goes that he was given an assignment in med school to, I believe it was to auscultate, listen with a stethoscope to, this would have been in the Soviet Union, 1950s. I believe the story is he was in a terminal ward, a ward of very unwell, one big room full of lots of beds and very unwell people. And his professor said, okay, here's your assignment. See if you can find a way that we can listen to their hearts without having them sit up, because they're too unwell to sit up in bed. Mm-hmm. And what Buteyko noticed, I think before he even began his assignment, was the sound of everyone breathing. It was quite loud in the room. And the story goes, he asked his professor, so, okay, I'll give this assignment a stab, but what's with all this heavy breathing? Why is everyone, I get it, they're all unwell, but why are they all breathing so loudly? Why is it so audible? And I think that he had a little bit of an intuitive moment, and instead of completing his assignment, he went from bed to bed and tried to persuade the people, figure out a way if he could get them to calm their breathing down. And when he did that, at the first bed he was at, he spent some time with whoever was in that bed, got the breathing to calm down, and that person began to feel a little bit better. So the story is he went bed to bed, stayed up the whole night, went from bed to bed, and by the morning, the sound of everyone breathing really loudly was gone from the room, and everyone was looking and feeling quite a bit better. His own situation was that he had extremely high blood pressure. He was, I guess, in that sort of risk category that, that he would have understood as a med student doesn't
Hmm.
necessarily guarantee a really long life. Um, so and then he began to notice how erratic his own breathing and noisy his own breathing was. So in many ways, he was his own first patient. And then, so he was able to calm his own breathing down, and he felt his blood pressure normalized. And when he graduated from med school, he was allowed to continue to research breathing. And I think he had about 10 years with, a lot of support, med students as his assistants, and allowed to develop some equipment. And he just kind of worked on this approach to calm down what, up until, or what is referred to as chronic hyperventilation syndrome. So to really understand what Buteyko is all about, you need to understand chronic hyperventilation syndrome. Now, the medical literature is few and far between on chronic hyperventilation syndrome. It goes back to the American Civil War. The first, record of it being discussed goes back to the U.S. Civil War. It was more in the 1930s and 1940s that some medical researchers and doctors took an interest in it. The term chronic hyperventilation syndrome was first coined in the 1930s. But I sent you a couple of articles, more recent articles about it, the Megarian and the Gardner and Lum, and they all write about it. They're really good at describing the two key things about it. The first key thing about it is loss of pressure of arterial carbon dioxide from excessive breathing. The other thing that makes it really difficult for the medical community to kind of get a handle on is that it's breathing, and breathing really reaches into every, biological function in the body, every organ system, everything in your body needs you to breathe, and so they, it's okay. So, Lum, for example, was a cardiologist. He said, okay, I think this excessive breathing phenomenon is affecting people's hearts. Other people come along and said, I think it's affecting their respiratory system. I think it's affecting their mind. I think their nervousness and anxiety and panic. So it was too broad. It was really too broad for the medical community to kind of like get a handle on it and understand what to do about it.
Mm-hmm. And really, like, they're all right.
Well, yeah, it is all that. That's the thing, is it is all that. And in Western medicine has become so specialized that no
Yeah.
one's stepping back a few paces and going, okay, let's look at a bigger picture here.
Well,
that's just not their focus.
yeah, no, well, and part of what I really like when we can find natural ways that we can do that are inexpensive, that can have such a profound effect on multiple body systems. It's like, really, I think for the most part, if you got almost everybody to breathe properly, manage stress a little better, and fine tune what they were putting into their body, so many chronic illnesses start to just disappear without looking very much farther from that. Now,
Sure.
you had mentioned chronic hyperventilation. So maybe just tell us again, how did you end up getting into this? What was your story with it? Because you have a very personal story with learning Buteyko breathing. So how did you end up using it to find some benefit for yourself?
Yeah, I had been diagnosed with asthma as a child. I and when I was young, and even as a teenager, I didn't get a lot of asthma. My first trigger was from cats. So I could not be around a cat for months and not experience asthma. But anytime I was around a cat, sure enough, the asthma trigger, that was my first trigger, and I would get symptoms. As I got into my 20s, I began to get asthma more frequently and not always triggered by cats. And that just continued. The triggers seemed to pile up through my 20s and 30s. Finally, when I think I was 40, I got asthma from going for a jog, and that was, for me, that was like, okay, I got it. I can't deal with this anymore. I got to do something. As soon as exercise began to trigger asthma, that was kind of the thing that tipped me into like, okay, I got to figure something out here. I had always sort of tried some quote unquote alternative things for my asthma. I never really found anything really effective. A couple of things helped for sure, but at the end of the day, what complicated it for me was the fact that as a musician, I'm a wind instrument player. I've been a professional trombone player, since I was in my 20s. So the amount of breathing that you do to play a wind instrument was contributing to my chronic hyperventilation and contributing to my asthma. So when I guess I was 47, and my asthma had gotten really bad that the winter of 2005. And I was doing some renovating at our house, the house we own downtown in Toronto, and that my asthma just went through the roof and got really bad. My regular puffer wasn't doing anything anymore. I went back to my doctor. He gave me another puffer and said, look, this puffer is 5 times stronger than your old one. Be very careful with it. Use it sparingly. And because I want you to use it sparingly, here's another puffer, and this puffer is steroids. So there I was with my 2 puffers and just thinking, this is not good. This is not going to go anywhere good. I do not want to be dependent on these medications to get through my day. I was dependent on medication to get through my day. Anyway, that winter I was back on the internet, trying to find another alternative treatment or something I could do. And that's when I first started reading about Buteyko. At that time, there was very little on the internet about Buteyko. So all I could find really were websites from teachers in Australia and New Zealand. And I sent them emails. I sent out some emails to these teachers down there, said, I'm in Canada. There were no teachers in Canada then, 2005. But they directed me to this Canadian woman who was living down in Australia, who'd made the decision to come home and start teaching here. So that was a woman named Chris Bauman. I got in touch with her. She said, yep, I'm coming back to Canada in, a couple of months, and I'm starting in Victoria, and I'm going through all the major cities teaching. And so you can either, meet me in any city you want, but I'll be in Toronto on this particular week. That was, I think it was June of 2005. And so I signed up for the course, and that's I believe it was the first Buteyko class ever taught in Toronto. Anyway, there were 6 other asthmatics and myself in this class, and Chris started talking about, what's the real cause of your asthma is that you're chronically breathing an excessive amount of air. And I was like, oh my God, can I get my money back? Like, this is ridiculous. I had no idea what she was talking about, and I didn't really, and I thought as a wind instrument player, I had a pretty strong understanding of the breath, of breathing. And I think also, so I was extremely skeptical in the first couple of classes. I think one of the sort of light bulb going off moments for me was, he was talking about chronic hyperventilation, chronic excessive breathing. This was the underlying cause of our asthma, all the people in the room. And then I think she could probably see the skepticism on my face. And I, and because I wasn't hiding it, I don't think. And she said, okay, put your hand up if you snore. And so all 7 hands went up. In that moment, I went, oh, all these other asthmatics, I knew I snored. I was constantly reminded how loudly I snored. And all these other hands went up. And I went, oh, that's interesting. So she's saying there's a connection between my snoring and my asthma. That had never occurred to me. No one had ever, doctor, and no one had ever said that to me. But I found that idea kind of intriguing. And the idea that what she was going to teach me was not only going to help with my asthma, it was going to, help with my snoring. So anyway, that was kind of a moment for me when I thought, okay, so this is kind of interesting. this may be worth pursuing, you know. And then when I learned Buteyko, we were taught, it was 5 classes. The standard sort of course is 5 classes, and they were on 5 consecutive days. So it was like a Monday to Friday. By the Thursday, I noticed that I had used my puffer less that day. And so that was kind of another indication, like, oh, so I don't get this, and I don't understand how this is working, but it does seem to be having a positive effect. And I think from that, 4th class on, I really threw myself into it, became very dedicated to it, and worked really hard, put in the time. And that's the thing I try to tell all my clients: look, this takes time and effort. I'm going to show you how to work on your breathing, but really you're the one who's going to do this. Mm-hmm. This is up to you. I'm just giving you the tools. So I felt benefit from it quite quickly, and asthmatics generally do. Buteyko has a bit of a reputation as an asthma treatment, but that was never Buteyko's idea for it. It just happens to be very effective and work very quickly on asthma. So anyway, I just really threw myself into it, did all the work, which is basically just these sets of breathing exercises that I was doing multiple times a day, plus a bunch of other guidelines around breathing.
Nice.
And yeah, go ahead.
I want to break down a little bit, because you said something really important when you were talking about asthma, and you said that one of the first things she told you was that you were breathing in too much air. Uh-huh. So let's sort of unpack that a little bit, because this ties directly with when you were talking about the chronic hyperventilation. So can you kind of explain what that means, sort of, because this is almost an epidemic of what's going on with people. And maybe we can unpack that a bit so that people get what that even means, and right, how that impacts so many different systems because of this over-breathing and this chronic hyperventilation, and what's sort of going on with that it can create problems with asthma and snoring and blood pressure and anxiety. And I mean, you name it, it's got a long laundry list of things that get affected. So how can something that seems really quite benign creates so many downstream problems?
Right. Okay. Yeah. And I think that the first thing that I would say about chronic hyperventilation is I was completely unaware that I was doing it.
Absolutely.
Yeah. Right. I had no sense that I was breathing too much air. I knew about my snoring, and that, if you think about snoring, it's a pretty strange way to breathe. But I, by day, I had no sense that there was something unusual about my breathing, or that it was excessive. Mm-hmm. One of the first things we learn in Buteyko, or that you're asked to work on, is to basically keep your mouth closed, and do all your breathing through your nose. And at the time when I learned that, I was told that, I just thought, well, okay, I don't think I can do that, because my nose was a disaster a lot of the time. And I thought, I'm not going to be able to get enough air through my nose. It's always plugged up and giving me problems. But in the act of trying to keep your mouth closed and breathe through your nose all the time, you begin to understand what they're talking about, because you notice from time to time, you're trying to move quite a bit of air through your nose, but you're not doing anything that is, there's no metabolic demand for that extra. It's like you're sitting in a chair and you notice, well, my breathing's kind of excessive. With your mouth open, you don't necessarily notice it. So that for me, it was like, really, like, I don't get this chronic hyperventilation thing until you start to work on Buteyko, and the instructions for Buteyko are not complicated. Doing them for a chronic hyperventilator can be challenging, and it was for me, for sure. Just keeping my mouth closed and breathing through my nose all the time was challenging. So basically, when we talk about what causes chronic hyperventilation, if you had to come up with a one-word answer, that one word would be stress. Mm-hmm. And by stress, we're talking about a very, very broad definition of stress. So anything you can think of that's stressful, emotional stress, like job, family, all that kind of stuff might be stressful. Maybe you drive in rush hour traffic every day, that can be stressful. Sedentary lifestyle that Westerners live is stressful to the body. Dietary stuff can be stressful to the body. Pharmaceuticals, which so many people are on these days, stress to the body. Another sort of cohort of people that I've worked with are people who are really obsessed with working out. Go to the gym, push themselves really hard in the gym, mouth breathing while they do it. And then 10 years later, they've got sleep apnea. And they go, how can I have sleep apnea? I'm ripped. I'm so fit. I go to the gym every day and I really push myself for an hour and a half at the gym every day. And I'm, 36 and I've got sleep apnea. How is this possible? So we basically say any chronic stress, any stress in the body makes you breathe more. Any stressful situation, you're breathing, whether you notice it or not, your breathing volume will go up. So if that stress is chronic, then that excessive volume of breathing becomes chronic. Then what happens there is quite interesting, and that's where the science gets a little bit more onto the theoretical side. Buteyko had ideas. His idea was once you're chronically excessive amount of air, and if that's been going on for weeks or months or years, he said the brain actually makes some kind of change where it gets tricky to kind of explain all of this without taking a heck of a lot of time. But basically, the brain makes a change where it believes that, so all this excessive breathing has led to carbon dioxide loss, right? We inhale, the air in the room, and when we exhale air that's fairly rich in carbon dioxide. So if you're exhaling a lot, if you're breathing a lot, moving a lot of air in and out of your lungs, it gets difficult for the body to regulate carbon dioxide. And that's something that's really key to understanding Buteyko, is that our brain, in regulating our resting state breathing, it's actually not too concerned with oxygen. What it's trying to do is regulate carbon dioxide. So anyway, if the breathing is excessive, you just lose pressure of arterial carbon dioxide. Combination of losing carbon dioxide and bicarbonate.
Right.
And it's that, and then what the brain does is it acclimatizes to that. And that was kind of where Buteyko's diverged a little bit from some of the other people who were thinking about chronic hyperventilation, is he said, I think the brain acclimatizes to this low carbon dioxide, low bicarbonate, such that if the carbon dioxide were to go up, the brain thinks it's gone too high and breathes excessively to bring it back down. So you're stuck. You get stuck in this chronic hyperventilation pattern.
And then does that retrainable then by doing the specific Buteyko breathing? So you're almost like through like a neuroplastic model, you're starting to retrain the brain to reset the CO2 levels then?
That's the idea. That's
Okay.
the idea. And it's like I said earlier, sort of the idea behind Buteyko is not really complicated. It's, basically, if I had to sum up Buteyko, I would say breathe less. And when I was, first learned Buteyko, I did my first set of breathing of the Buteyko exercises that I was taught. The idea is for a certain time period, 2 minutes, 3 minutes, breathe less air than you would normally have breathed for those 2 or 3 minutes. You're sitting in a chair, so you're in resting state, quiet breathing. So the idea is, sit there for 2 or 3 minutes and breathe less air. And when we teach people, we guide them through that. We cue them through that process here's the approach. Just try and follow what I'm saying. So that's kind of how that works. But when I learned it, and my teacher was cueing me, and I remember just thinking, how can breathing a little bit less air for 2 or 3 minutes make any difference at all? And why would that even be hard? Go ahead, start the clock, set it for whatever length of time you want. I'll breathe less air for that time. And then in my using my own sort of arrogance, and then when I actually tried to do it, I thought, like, why is this so hard? I am dying to take a huge breath here. My body, my brain's going, come on, what are
Yeah.
you doing? Normally we hyperventilate. Why are you trying to control that? So there's a little bit of a struggle that goes on with your own, respiratory physiology when you first learn Buteyko, because your brain resists that trying to breathe less thing,
Yeah. And I find sometimes it even kind of stirs up for people initially almost a little bit of like stress response just in the process of trying to, it's like, I mean, even in different philosophies, it's even the out breath and even slowing down and even holding the out breath for a bit, that's scary for people. It
Yeah,
triggers a little bit of like a fear response until you start to work with it and reprogram what that even means and how you respond to it. But I know even when I first started doing it, and same idea as going through, is like, okay, like I can feel almost a little bit of, you get that low grade almost panic sometimes, like you need to take a breath of air, and
yeah.
really you don't, but that's what it feels like, and there's a lot of parts inside of you that are fighting that for the first little bit.
Absolutely. I mean, I've taught a lot of people now, and you have to be very careful and watch very closely, and be prepared that you're going to take people into anxiety. And so there's a very, you have to work with the person that's sitting across from you, And so I approach things very gently. And
Hmm.
I can tell, there's certain, like if the asthma is really bad, or if there's an anxiety or panic component to it, or the person seems very unwell, and we have ways of kind of assessing that. Um, um,
Absolutely.
then
That's why I
the
think it's so
approach is very
important.
gentle.
Yeah, and it's why it's important to work with an instructor to get all those nuances in it. But what I found was interesting is that sometimes it can feel a little bit of that sort of panicky or anxiety response coming up a little bit, but at the same point, Buteyko is a really powerful tool for minimizing anxiety and treating anxiety and panic attacks. So,
Yeah.
how does the process of recalibrating that CO2 level again by slowing the breathing down, how does that start to have an effect on things like anxiety? What's going on? How is it actually helping with something like that? Because it really does have lots of effects, like whether you are decreasing anxiety, or you're improving asthma, or improving digestion, like irritable bowel syndrome. All these different things can be affected. So what's going on in the body when we start to fine tune the breathing? How are we having those types of effects?
Well, that's a great question. I think there's probably a bunch of different ways to answer it. I think if you look at the nervous system, um, you know, um, when we go into sympathetic dominance, which is an anxious state, um, um, breathing goes up, right? So ideally, what we're doing is kind of bringing people into a lower volume of breathing, which will have a calming effect if you manage it very carefully. Won't have a calming effect if you don't manage it carefully. And so that kind of comes into, or speaks to the skill of the teacher. When I first learned Buteyko, or sorry, when I first did my training to Buteyko teacher, I was only allowed to teach as for asthma. So
Mm.
my first 50 clients had to be asthma. And then I was allowed to expand into other things. And so that kind of gives I guess probably I had a big advantage as someone who had asthma, and used Buteyko to climb my way out of that. Um, I kind of had an advantage because I could really relate to the person sitting
Sure.
across from me if they had asthma. So yeah, no, but it's always and to be completely honest, I have had clients where the anxiety level was so high that I couldn't. One client in particular who had a very traumatic experience. I couldn't get her to relax her abdominal muscles. Like she was in such a state of anxiety that relaxing her abdominal muscles felt unsafe.
Mhm.
So that's kind of the one client I can think of where I went, okay, you know what, this is a little out of my scope of practice. She's not ready for me. She's not ready for this. You know, if so, that's an important thing I think to understand with Buteyko, because it has the potential to pull you out of relaxation, right? If you're trying to underbreathe, you know, it has the potential to create anxiety and pull you out of relaxation. It's really difficult to get anywhere with Buteyko if you can't relax. And I mean physically relax the body, relax the abdominal muscles,
Mhm.
you know, relax the jaw, relax the shoulders. So those two sort of things, and it's like it's a little bit of we're asking people to do these contradictory things. On the one hand, I'm saying relax. On the other hand, I'm saying breathe less, right? So those two things are kind of like pulling at each other a little bit. So again, it just comes to guiding the process very carefully and being really observant.
Right.
And I think, you know, creating a situation in which the person I'm working with feels that they can be really straightforward with me about how things are going for them, and be, you know, and like when I said, when I learned it was in a group, I decided very quickly that I didn't want to teach groups, that I wanted it to work one-on-one, kind of for that reason. I think if a group is all asthma, that's fine. But to teach, you know, someone who has panic attacks with someone who has asthma, someone who has sleep apnea, you know, all together, I found it really hard. So I just stopped doing it. Yeah. Um,
Well, and one thing
sure there was,
I was thinking about with it that from my understanding with it is when we are in that hyperventilation phase, so we're in a stress response, which a lot of times people are in and they don't even know that they're in a stress response, but mostly throughout the entire day, they're sort of breathing up and through their chest. They're not breathing through their lower diaphragm, or so they're breathing too much air. They're breathing too quickly. So they're blowing off a lot of CO2. Now, from my understanding, where it gets a bit tricky sometimes for people to understand is that if that CO2 gets too low, then that actually affects our ability to utilize the oxygen that we've got. Is that
yeah,
correct? Because you need to have a certain amount of CO2 to actually liberate oxygen from hemoglobin so we can actually access that oxygen. So even though where it almost looks like we're breathing in too much oxygen, we're not really able to utilize that oxygen. So in a
right.
lot of ways, it seems like the physiology of all the benefits comes from when we get that CO2 back into that sweet spot where we've got enough of it to be able to liberate the oxygen from hemoglobin. Now we actually can oxygenate our tissues properly. And outside
Yeah,
of that, I think you had mentioned before, you get a nitric oxide release, which dilates blood vessels and dilates the bronchi. So all of a sudden you don't feel like you're struggling for air so much, right?
yeah, yeah, yeah. You're describing the Bohr effect, you know,
Yeah, exactly.
which was discovered, you know, by Christian Bohr in 1904, I think. And what the Bohr effect basically states is, um, that so when we breathe in, the oxygen, you know, goes into the lungs, goes into the bloodstream, goes into the red blood cells, and actually bonds to the hemoglobin molecule. You know, hemoglobin molecules have four iron molecules, and it's to that, you know, oxygen and iron have an interesting relationship. If you've ever had a car rust out on you, you know what I mean. So
Yeah.
so the oxygen bonds. One oxygen molecule can bond to the one iron molecule in the hemoglobin, and there's four in hemoglobin. So hemoglobin is capable of carrying four oxygen molecules. Now, but it's actually the oxygen's actually bonded there. So then that blood goes from the lungs to the heart. The heart pumps it throughout the body, and when the blood gets to the capillaries, it's supposed to be letting go of that oxygen to feed oxygen to the tissues of the body. What breaks that chemical bond between the oxygen and the hemoglobin is carbon dioxide,
Hmm.
or more, to be more accurate, well, partly carbon dioxide, but also hydrogen ion created by the carbon dioxide when it goes through this process of creating bicarbonate and a hydrogen ion. So anyway, the point is, it's the amount of carbon dioxide in the body, the pressure of carbon dioxide in the body, that determines the effectiveness of Bohr, of the Bohr effect, and determines the effectiveness of oxygenation of the tissues. So if your CO2 is low, you are chronically underoxygenated. And how that affects any individual person depends on genetic predisposition. So I have the genetic predisposition to asthma, chronic hyperventilation. That's how it affects me. I get asthma symptoms. The smooth muscle around my bronchial tubes constricts, and I make too much mucus because the mucus producing cells are also underoxygenated. I make too much histamine.
Yeah.
Because my mast cells are underoxygenated and they lose the ability to control histamine production. So those three things, mucus and histamine and constricted bronchoconstriction are what cause asthma. That's just the effect that hyperventilation has on my body because of my genetic predisposition to asthma. Other
Right.
people, it might be angina, it might be heart. Other people, digestion. Other people, panicking and anxiety. And
Muscle
very often,
spasms. Yeah.
for muscle spasm, and very often it's a combination of things. So very often asthmatics have anxiety things going on or digestive things going on. And they
Wonderful.
don't necessarily put them together. And certainly the medical community doesn't put them together.
No, that's what I really love about systems like this, because you're not addressing individual symptoms and looking at them as separate problems. You're really getting back down to a root core problem, that when that starts to get corrected, you do have these global effects. You basically turn on the body to basically start to auto-regulate again the way it's designed to. And I really
Yeah.
appreciate the way you broke that down. That was something I wanted the audience to hear, was all the different ways that hyperventilation can show up for you, as far as what would people be looking for to know that they were hyperventilating. Because like you said, you didn't even know you were hyperventilating. So what would be some of the key signs and symptoms that would be a flashing light for someone to say, yeah, okay, that's my aha moment, that I'm hyperventilating and I need to work with that? I guess the
Uh-huh.
things that jump out to me first would be, I had very much the same sort of symptoms as you. So some of the symptoms like asthma or allergies, but snoring I think of as a pretty classic one. But what are some of the other ones that maybe you've seen that jump out to you for somebody?
Well, as you said, allergies, especially pollen-based allergies, asthma, snoring, sleep apnea, chronic cough.
Sleep
I
apnea,
see
yeah.
a lot of chronic cough, chronic fatigue, eczema, sleep issues, poor sleep, insomnia, irritable bowel, nasal stuff like nasal polyps, sinusitis, or just, chronically kind of stuffed up nose. And then kind of more general symptoms are people who yawn a lot and sigh a
Right.
lot. People might not notice that in themselves, although I've had a lot of clients who said, I'm told that. Like, they don't actually notice it in themselves, but yeah, I've been told that I sigh a lot, or I've been told that I yawn a lot. Lightheadedness, cold hands and feet, dry mouth when you wake up, um, easily tired, poor sleep,
Yeah,
and then
that's great.
anxiety, panic. Yeah.
That's great. Yeah, that gives lots of people are just checking off their list, going, I've got that and that and that. And
Yeah, it's
well,
interesting when I do. Have people when they come to me, I have them fill out an intake form, and they've got asthma or they've got sleep apnea, and that's why they're coming to see me. But when they actually start to go through this list of stuff, they go, "Oh yeah, that's me. That's me too.
yeah,
I do that too." So there's actually a whole bunch of signs to them, and that's a really, I think, key thing for those people is to see all this stuff's connected, and it's all connected to your breathing,
yeah,
and to your point a minute ago, Buteyko, I think in a way it's kind of the ultimate holistic practice, because breathing is everything. Breathing is what's going to keep us alive for the next 5 minutes. So if there's a disorder, or if the breathing is dysfunctional, it only makes sense that something's got to break down in the body. Something's going to suffer from, as a result of that dysfunctional breathing.
Yeah, absolutely. And one other group that I'm seeing a lot of, because in my practice as a naturopathic doctor and an osteopathic manual practitioner, I see a lot of pediatrics too, and I'm seeing a lot of children coming in with um, chronic congestion, chronic nasal congestion, uh, enlarged tonsils and adenoids, and
Yep.
this whole group. And really, there's a lot of kids now that are coming in with these types of allergies and asthma and whatnot.
Mm-hmm.
And what I think what is really important too, and they're mouth breathers. So they'll come in and their mouth is open, they've lost the definition in their cheekbones already, their
Yep.
mouth hangs, the nose is starting to get a little bit bent.
Yep.
Like all of this stuff really dramatically affects face structure too.
Yep.
And when we are breathing optimally, a lot of people don't realize the resting position of the tongue is to be touching the roof of the mouth. And in
Yep.
that little bit of pressure is what really creates the structure for the face.
Yeah.
So
Yeah.
are you finding that a lot of children that are having this type of issues? And then how do you work with kids? Because it's a little bit trickier sometimes than working with adults, as far
For
as,
sure.
compliance and what. So what are your
Yeah.
thoughts around that?
Well, I would say that the one, field in medicine that's really embraced Buteyko and kind of discovered us and is dentistry and orthodontics.
Yeah.
And that goes back to the 90s in Australia, where I think as a result of their own research, they began to understand that the real cause of crooked teeth, poor facial development, poor jaw alignment, um, um, is mouth breathing during sleep. And so they went, okay, so all we got to do is make sure kids don't mouth breathe during sleep. There's a really interesting video by a guy named Dr. John Flutter, dentist orthodontist, from a Buteyko conference in the 90s. And he said, 10% of the kids I see, I can tell them just keep your mouth closed, and it works. 90% of them can't just keep their mouth closed, and that's when I send them to you, referring to the Buteyko teachers that he was talking to. So, you can't just tell a kid, close your mouth and keep your mouth closed when you're asleep, because when you're asleep, you don't know what your mouth's doing. And so that's what, we see. We've kind of created a real bridge with the dental community. And there's a lot of Buteyko trainings going on in dental clinics now, where they're seeing, they kind of see it as the missing link. This is the thing we didn't get, this is the real cause of tooth decay. This is the real cause of crooked teeth. It's mouth posture, particularly during sleep, because that's when kids do a lot of growing, is during sleep. So if a kid is growing like this, nothing's gonna end up, the whole structure of the face gets changed. And
Yeah.
that includes, and then the mouth's drying out every night, so it's changes the nature of the bacteria in the mouth. If it's dry and becoming more acidic, so the bacteria that you don't want thrives, attacks the teeth and the gums. It's been really interesting that we've kind of got a foothold with the dental communry a little bit.
Yeah, it's a group I work a lot with too, because they are well versed in that. Out of all of them, the dentistry part of the dentistry that's really embraced this, especially if I'm working with patients or dentists that it might be more in orthodontics or ALF appliances and some of these things, especially the ones that are looking more at ALF appliances to work with jaw structure. They almost always have a Buteyko practitioner or trying to teach people how to do that, because it is such a important home care.
Yeah.
Um,
So as for how we work with kids, most of the Buteyko stuff that you teach, that I teach adults, involves them just sitting quietly in a chair, and it doesn't always work with a 7-year-old. So a couple of people in Australia, the Russians who first went to Australia, kind of developed a different approach to take with children. It involves getting them up and moving around, and it's very effective. And I don't just teach that to children. Sometimes I teach it to adults as well. There's a particular kind of adult that will work well with. And so, yeah, so we teach kids quite differently than we teach adults.
But you
And it,
find
and
that
it,
you can work with them pretty effectively though, and start that process.
oh, for sure. And I mean, a big part, I mean, the thing is with Buteyko, there's homework, right? So a
Yeah.
big part of, like, when I teach a child, the first class is just with the parents, and I say, here's what I'm going to be teaching your daughter. And this is what she's got to work on a daily basis. And so you've got to make sure, so I teach the parents, this is what I'm going to teach her, so that what she's supposed to be doing and whether she's doing it correctly or not. Um, and just that parents will do stuff for their kids that they won't even do for themselves. They'll make sure their kid does the breathing exercises every day. And, and the other thing that,
Very true.
yeah, the other thing that, that I should say about Buteyko is that and this is, you probably already know this, is that we have people put tape over their mouths for sleep to ensure nose breathing during sleep. And, I'll just tell you, when I learned Buteyko back in 2005, and part of it was, like, my teacher said, okay, so you all have to go out and buy a roll of this certain kind of tape, just a skin tape, and tape your mouth at night for sleep. And I just thought, okay, like, I am out. I will do anything you say, but I'm not doing that because it's too weird and I'm going to die. And so I was quite afraid of that, because I just had no confidence in my nose that it would stay clear all night. The thing is if you keep breathing through your nose, it stays open. Even if you have a cold or bad allergies, if you just keep your mouth closed and breathe through your nose, it might get a bit stuffy, but it's always going to stay open. Secondly, there's no way you're going to die in your sleep because your mouth is taped. You're going to wake up long before you ever get anywhere near that kind of situation. So anyway, but I was terrified. And so I actually didn't tape my mouth at the beginning. But I worked really hard on the breathing exercises and followed the guidelines as best I could. And about 3 weeks into it, my teacher called me up just to check in and see how I was doing. I said, and what had happened was I'd been progressing steadily and doing well and getting better, and less asthma medication and less asthma symptoms. But I'd gotten to a point where I'd kind of stalled for a couple of days, 4 or 5 days, where I just didn't seem to be progressing. And I told her that, and she said, okay, well, she asked me a bunch of questions, and I said, yeah, I am. Yeah. And she said, and you're taping your mouth for sleep. And I went, well, no, that's the one thing I haven't been doing, because it's too scary. And she said, okay, look, if you're happy with where you are right now, you don't have to tape your mouth. But understand that all that work you're doing by day is being undone to some degree every night when your mouth pops open. And that's when I went, okay, so I'll try the tape. So I went out, bought a roll of tape, taped my mouth. It wouldn't stay, it's the glue that on that tape we use is not very strong. So if you're a snorer, and your tendency to snore and your tendency to hold your mouth open, the tape just can't keep up with that. So the first night, it was completely off my face in the morning, and the second night and the third night. And then I had started to have a couple nights where it was sort of half on my face. And then another, probably, I think it was like about the 10th or 11th night, gradually this gap that I was blowing through got smaller and smaller, until about night 10 or 11, there was just a tiny little hole. And then one morning I woke up, it was completely sealed, and I had a night's sleep like I hadn't had in 20 years.
Mm-hmm.
It was unbelievable. I literally fell asleep and woke up. Suddenly it was morning. I'm like, it's morning? Like, what just happened there? Because I didn't sleep well. No hyperventilator sleeps particularly well. You get up to go to the bathroom because of smooth muscles squeezing your bladder, so you think you've got a bladder full of liquid, then you go pee and there's actually not all that much. You go back to bed, and 2 hours later you got to do it again. Or you just don't sleep well. You wake up, or you're in very light sleep a lot of the night. Hyperventilation, when you're actively hyperventilating, you tend to your nervous system is not regulating well. And if your nervous system isn't regulating well, there's no way you can stay very long in deep sleep. So anyway, so for me, the mouth taping, and it tends to be this way for most people I teach, the mouth taping for sleep is a game changer. It makes a huge difference. And people can't believe the difference between breathing through the nose versus breathing through their mouth, and how well that regulates sleep and the nervous system and oxygenation of tissues and everything. So a big part of learning Buteyko when I teach is like, we spend a lot of time talking about the nose. In my workbook I give clients, I've got 3 pages of the benefits of nasal breathing versus mouth breathing.
Mm-hmm.
So, and when you look into, respiratory anatomy and respiratory physiology, you see, wow, the nose is actually kind of ingeniously designed, as the way to get air into the lungs and air out of the lungs. And the mouth just doesn't do any of the things that the nose does.
Mm-hmm.
Like you mentioned nitric oxide and.
Yeah, I think I read somewhere the nose actually has about 30 different functions, not just for air, but and even outside of just filtrating it and warming it, and then there's nitric oxide. There's a lot of stuff going on. So if you're not doing that piece that is really you're designed to be using, then you're not gonna get all the benefits from it. But I
Exactly.
found the same as you when I would get patients to and sometimes what I do with people that might be really scared about it at first, I've had them tape their mouth, but I've also had them put the nasal strip on just to feel like it
Sure.
it opens it a little bit, so it gives them a little bit more patency, so that they feel a little bit more comfortable with it, at least to be able to do. And that's what I've done myself before. If I've had like say I ended up with a bad cold and I had a ton of nasal congestion, and closing my mouth still felt really hard to get enough air, I found that doing that would give me a little bit more room. And then what generally happens is once you fall asleep, if your mouth is shut and you're breathing through your nose, then all those background pathways start to happen where you are making nitric oxide. Now you are dilating passageways. It's this catch-22. When we don't use the nose, then we lose the benefits of it, but we don't feel like we can use the nose, so then we don't use it. But if you
Yeah.
allow it to happen and you can get past that first bit and do it, then that system of autoregulation starts to kick in and all those
Exactly.
pathways start to work again.
Yeah, that's it exactly.
Mm. Wonderful. Steve, one more thing is just for people that want to start, um, even if they're just wanting something to practice and they're kind of curious about it, what would be a beginner place for people to just start a simple practice for it, or even a test? I remember looking at, I think Patrick McKeown would talk about sort of a breath hold test. What would be a healthy breath hold on exhalation that people can do to give an idea of whether they're in an okay zone or not? Do you use a breath hold test like that?
Yeah, yeah. So what you're describing is a thing we call control pause. Um, Actually, it has a few different people call it different things. It's most commonly referred to as control pause. Um, Patrick, in all his books, referred to it as control pause until his new book, and then he's changed it. He's changed the terminology. There's a couple people in Australia, Tess Graham, who call it comfort pause. But basically, the idea is that you have to be in a kind of your quiet breathing. So you've been sitting in a chair for a couple of minutes kind of thing, and your breathing's come down to your regular quiet breathing volume. And then you, at the end of just a normal, gentle exhale, I'll say one thing, control pause is a little tricky. Doing it accurately and properly is a little tricky.
Mm-hmm.
And so most people have to do quite a few before they begin to get it.
Gotcha.
But the idea is come to the end of a normal gentle exhale. Your mouth is closed, you're breathing through your nose, you pinch your nose and you hold it and you wait until the first urge to breathe and you time how long that is. So
it's not the first until you holding it until you're like almost passing out, but it's that first
no,
sign of air hunger. Sometimes I find
yeah,
people tend to fight it and hold it longer, but it's that first real sign where you get that air hunger, right?
Yeah, if you're fighting it and holding it longer, that's not a control pause
Yeah.
anymore. The control pause is kind of the first urge to breathe. And
Okay.
again, that's not a really obvious moment for a lot of people. And so you have to do it a bunch of times, and then you'll kind of get it. And even if people, okay, so for example, people with an anxiety issue, they'll tend to let go too soon. People who are kind of whatever, I don't really understand what people mean when they say A-type personality, but people who are really kind of go for it kind of people, they'll hold too long and they'll let go, and there'll be a
Right.
big inhale and go, okay, so that you didn't do it right. Not that negative about it. I'll say, okay, that's not quite it. You
Hmm.
held it a little bit too long. I could hear that inhalation, so that was too long. I don't want to hear it. I just want it to be a let go, and there's a normal inhalation through the nose. So generally, people usually have to do quite a few of them to get that moment. And then, even if, I still have clients who will go a little bit too long or go not quite long enough. And I'll say, look, as long as you're being really consistent, that's it. Just try to let go of your nose at the same feeling every time. And so maybe your true control pause is 1 or 2 seconds longer or 1 or 2 seconds shorter from where you're letting go. It's okay. It's just so long as we can get kind of an accurate measurement. And then really, it's not about whatever that number is. It's about what changes.
Hmm.
And ideally, we're looking for that number to get longer and longer.
Okay. Gotcha.
Yeah.
Um, Steve, anything else that we missed? Anything else you think is really important that we didn't get a chance to talk about?
Um,
Other than then,
can't
I
think.
want you to share how people can get a hold of you and everything. But as far as about Buteyko, anything else that we missed that you think was important?
Um, I can't think of anything offhand. There's this one little quote from a medical textbook that I'd like to read. It's just one sentence,
Yeah, go for
and
it.
this is from Arthur C. Guiton, Textbook of Medical Physiology, 5th edition. And I know there's been more recent editions, and probably still has the same sentence in it. But this sentence is: all chronic pain, suffering, and diseases are caused by a lack of oxygen at the cell level. Right? So,
Hmm.
and
So true.
that's exactly what we're talking about in Buteyko. More oxygen to the cells, and because we tend to talk a lot about carbon dioxide, but it's important to understand when we're talking about carbon dioxide, what we're also talking
Yep.
about, or really talking about, is oxygen. And that's how, Patrick McEwen's most recent book is called The Oxygen Advantage. And I remember, I've met Patrick several times. We've been to conferences together, and we've communicated a lot over the years through email and stuff. And so I remember when he was writing the book, and we were in Boston, and this was 4 or 5 years ago. And he was saying, we have to change the conversation. We're talking about carbon dioxide, and it
And
just
nobody
goes
gets
right
it.
over
Yeah.
people's head. You talk about oxygen, they get it. So he called that book The Oxygen Advantage for that very, very specific reason. It's like, it's time. We're confusing people with all this carbon dioxide talk. Let's talk about oxygen, because that's really the point here, is to get more oxygen to the tissues of the body.
Yeah. Yeah,
Um,
exactly. Awesome. Steve, how can people get a hold of you? Because I know you run workshops, you see patients in Toronto, you also do online, so people can get a hold of you from anywhere in the world if they want to. Tell me a little bit about how do people get a hold of you? Where's the best place to reach you? Anything you've got on the go, workshops coming up, anything along those lines?
okay, so most people contact me through my website, unless it's a word of mouth and someone passed along a phone number or something like that. I actually recently taught a guy in the Bay Area, San Francisco area, who bought a Buteyko book at a used bookstore, opened it up, and someone had put a yellow sticky thing with my name and phone number. I'm like, what? So strange. But anyway, so my website is buteykotoronto, all one word, .com, buteykotoronto.com. So people can reach me through there. Buteyko is most often taught in a 5-class course. I tell everyone it's better to learn in person. However, there's so few of us around. People can't always find someone close by, and so I've been teaching online for quite a few years as well. Online works. What I stress to people is you need to be in a quiet location, and I need to be able to see you really, really well. And if they can fulfill those criteria, then I can work with them. Also, because I teach a lot of people, because it's 5 classes, sometimes people will come to where I teach in Toronto for the first class or 2 or maybe 3, and then we'll switch to online. Traffic in the city is so horrendous. If you're coming from Mississauga to where I teach downtown, you can lose an hour each way, right? So I often do that. I'll start with people in person, and then once I've seen them in person, I've got a pretty good idea of what's going on with them, and so then we can switch to online. But like, I've taught all 5 classes to people online as well, and it works pretty well. I've only ever had one client that I was teaching online where I said, you know what, I need to see you in person. I can't figure this out online.
Yeah, I think it is. I think things are moving more and more, and even the platforms you can use to do online work really well. I do a lot of telemedicine as well, and it's I find it incredibly useful, and you can work with people all over. So
Yeah.
time and your expertise and sharing all of your knowledge with everybody. I will make sure that your website and contact info is in the show notes. So
Okay.
anybody get a hold of you, they'll have access to it there. And
Great.
once again, thank you so much. I really appreciate your time.
Oh, thanks so much, Jason. It's been my pleasure.
Well, that was awesome. Thank you so much for taking the time to invest in your health and well-being. Since this podcast is brand new, reviews and subscribers are so vital for us to get off the ground and share this really important information. So if you found this information valuable, please post a review and subscribe to the podcast so you'll get our newest episodes. Also, if you know of someone who would benefit from this, please share it with them. You can also find us on Instagram at #InspireHealthPodcast. If you have a question that you'd like to be addressed, direct message me on Instagram or leave a comment on one of my posts. I would love to hear from you. And you can grab our show notes and free resources for each episode at inspirehealthpodcast.com. So be sure to go online and check it out.